Hi, everyone. I'm back. Sorry, it always takes me ages for some reason to figure out how to share. There's presenter view, there's audience view, there's a lot of other factors. Welcome, and I finally remembered to turn the chat on. Hello, hello. Hi, everyone. Welcome, welcome. We're starting a little bit late, but I think that's okay because this is by far the shortest presentation I've made. So I'm not sure we'll make it through the whole hour and a half anyways. But thank you for your patience. Thank you for joining me tonight. Happy to see some familiar names in the chat, including Noelle, who I had the pleasure of meeting in person just not yesterday, Thursday, it must have been. So as an inspiration to the others, please come and say hi to me if we ever run into each other. So nice to see you all here. Today is our very last medical English class. I know it's crazy. It's already been 6 lessons. Let's look at what we have covered together. I'm even going to zoom through the one about me because at this point I feel like everyone here is an old hand. This is an expression to be an old hand or old hat. Sometimes we say it means that you're someone who's been coming a lot and you know the routine. So just so we can reflect back on where we started, we had a session about medical terminology, doing everything from sort of the respiratory system, cardiological, muscular, skeletal, all of these sort of basic terminology, which I think is when my lack of medical knowledge was the most evident right away. Then we went into communication skills, which we continued actually into the next session about medical examinations. And a lot of this was an interesting connection between medical English, which focuses a lot on terminology, specific vocabulary, and the soft skills, sort of communication, making requests politely, eliciting more information from people when we're trying to get information from patients. So that is also included in medical English are some soft skills that you can find in other arenas as well. Then we went and looked at prescription writing, medication management. This was really our pharmacology week. And last week we did mental health, which I think the pharmacy week and the mental health week were probably my favorite, just because of my own interest in these areas. And so this week we're finishing and we're talking all about conferences. It's a little bit, I want to say less medical because we're not actually talking about diseases or illnesses or conditions, but it's still a very interesting field. We will be talking a little bit more, not just about language, but also how to attend conferences or what are medical conferences, what can I expect from them in case you're someone who's here thinking, you want to get involved in the field of medical English in the practical sense. So you're not just looking for tips and tricks in communication, but actually from a professional standpoint, how do you use medical English to enter the medical English speaking world? And conferences is one of the best ways to do that. So this will take us maybe an hour, maybe it will take us all the way through, I'm not sure. Let's see. And I hope it is interesting for you all. And that will be the end of our medical English experience together. Juaria, I see your question. Can we have a participation certificate? Unfortunately, the class does not have any sort of certification. The reason for that is that these are actually live streamed and these are recorded and shared online, and we don't track who comes for 10 minutes, who comes for 90 minutes, who comes for somewhere in between. So it's really a free resource for you to progress professionally, and we don't have any kind of certification. But I hope that you still see its value in your life moving forward. And thank you, Noelle. I will miss all of you as well, my Sunday night crew. This probably won't be the last, I'll say. So the U.S. Embassy and the American Institute partner. So the American Institute is the language school that I founded and I run here in Algiers. And the U.S. Embassy Algiers funds this course with us. So they use our English expertise and in order to help spread information and language training throughout Algeria and throughout the world. And so this is actually the 3rd year that we've done this. So I anticipate that we will have opportunities to do more. You can let me know what types of topics are interesting to you, and we can put in some requests to the embassy. I see folks looking for the recordings of the previous sessions. So we are actually waiting until we finish the whole course and we'll upload it all at once. I know it's not the most amazing from the perspective of someone waiting for the courses, but for us, we're having a really busy season. So we just decided we'll wait till everything's finished, do all the editing in one go and upload them. So hopefully within a week, maximum 2 weeks, we'll have them on YouTube. Great, that's Abir and Mohammed. Hussein, we need more webinars like this. Great. You know what, if we finish early, we can have a little discussion about the types of topics you'd be interested in having webinars on. And I'm open to suggestions. The embassy is open to suggestions. These are designed for you, right? We are providing content that we hope is useful for those in our audience or those virtual students. So your input is valuable here. We'll come to that at the end. Let us begin. Let us begin on medical conferences. So it's funny, I left these slides in here, even though it's the last class. This is a free course. It's an online course every Sunday night, 6:30 to 8, recorded and published. Here's our YouTube link, although these courses are not yet up on YouTube, and they're open to everybody who wants to attend. Okay, moving forward. Oh, this is my disclaimer about not being a medical professional, which I think is not so relevant tonight for conferences. But of course, it's still important to know that the information I'm giving you is not from a doctor. It is from a professional English teacher. So I have a decade of experience teaching different kinds of English, but I have never operated on a human being. Nor even taken their temperature or drawn blood. So I think there are probably those in this room. I know that there are those in this room who have way more experience than me. So don't hesitate to correct me if I say something that is medically inaccurate. Take everything I say from a language perspective as from the expert's mouth. Anything I say that maybe touches on the medical side as, does Ariella know? We're not so sure. All right, so we begin. What are medical conferences? What are we talking about? Tell me in the chat if you had to say what a medical conference is, and I'd love your voice and your opinion rather than what you find on Google. What do you think of? Just send me even some keywords, it's fine. What is a medical conference and what happens at a medical conference? A seminar on a medical topic, okay. Nice, thank you, Hussein. Okay, a meeting to exchange experiences and research. Great. Already we have two different contributions that are both absolutely correct. Anyone else? I hope you know that my classes rely heavily on you sending me things in the chat. So get those fingers warmed up. I'll give 30 more seconds. Sharing experiences and sharing medical knowledge. Thank you, Ahlam. Sometimes to expose new medications. Okay, so in this case, we would say to show or to advertise. Expose in this context is a little bit of a false friend with French. To expose in English is to almost to reveal in a negative sense, like we expose a politician who is doing something controversial. Okay, so in this context, we wouldn't use the word expose. Introduce, okay, introduce new medicine, sure. Oral or poster communications, yeah, that's absolutely right, in that there are speakers and there are also sort of booths that you can go to. Meeting and exchange, advertising for new drugs, just experts who can talk about medical topics. Great, thank you, everyone. I have some examples of medical conferences. So everything that you have said is absolutely perfectly correct. We have seminars on medical topics. We have advertisements, demonstrations about new medications. We have researchers presenting their research or presenting new approaches, innovative approaches or solutions to illnesses. This right here is an example of a poster for a medical conference. This one just passed in April, and we have here the European Congress of Psychiatry that has a medical conference, and they have a website. You'll notice on the bottom, epacongress.org. They have a hashtag EPA 2024, and they have a slogan. So every year they will have a different slogan every year of the EPA conference. And this year we have mental health, open and inclusive. You can also see there's a brand identity. We have green and red. My automatic assumption, I'm thinking we have Christmas colors, which is kind of funny. It's in Budapest in Hungary, so maybe it changes every year. And it looks like we have some kind of logo for the conference as well. Here's another example, Mental Health America Conference, Washington, D.C., and online. So conferences nowadays are either happening partially online. Some conferences are still happening fully online since COVID. We have 3 different sections to the conference. So you can see in the bottom on June 6th, this was last year's conference, last June, they had a policy institute. So something that wasn't mentioned about conferences in what you sent me, but is absolutely relevant, is that a lot of conferences are geared towards or targeted towards policymakers, meaning they're trying to influence politicians. They want politicians to change laws. In this case, for Mental Health America, maybe they want stronger healthcare protections for people with mental illness. So they will have an entire day dedicated towards communicating health information to people like myself, not politicians, but people who are not doctors, right? So the policy day is about communicating to someone who's not a doctor, and then maybe perhaps targeting a politician or targeting advisors to politicians in some of the details that they can use to influence changes in government. Then the next day they have something called affiliate day. So an affiliate is, the word itself is quite broad. It just means someone who's connected. So not directly connected to the conference, not doctors, not medical students, but almost like a partner. So I don't know, because I just took these, I have, I think, 4 conferences to look at as examples, just to see the differences when we say medical conference, the types of conferences there are. But my guess, if I had to guess, I would say affiliate probably has to do with people who are selling medical technology. These conferences actually charge a lot of money to producers of medical equipment. And, sometimes people will pay thousands, maybe even $10,000 to have a booth where they can sell equipment. So an affiliate, I'm guessing here, I'm not sure, but I'm guessing that affiliate day is all about, going into the version in Washington, D.C. of SAFEX, right? Going into a big conference hall and meeting people who are trying to sell equipment. And then June 8 to 10, we have the main conference. And at the main conference, you're going to find speakers, usually panels of speakers, which a panel means there's multiple speakers at once on different topics. You'll meet researchers they also have booths similar to those selling technology, but at these booths, they're not selling anything. They're presenting their research. Maybe they're looking for collaboration. They're looking for opportunities to do more trials, et cetera. So the last 3 days of the conference is really what I would call the meat of it. The reason people go to these conferences, it's doctors connecting with doctors, it's medical students and medical researchers also connecting with doctors and connecting with each other. Great. So again, the conference appears to have a logo. It looks like a bell here. We have a visual identity with orange and blue, and we have a theme for this year's conference, which is next gen prevention. Does anyone know what they mean by next gen? What does gen stand for, is what I'm asking. Okay, the new way, generation, great. Next generation prevention. So when they say next gen, thank you to Yassine, who gave me kind of a synonym of this, which is saying the new way, kind of the next stage, the next way, futuristic, new methods, new beliefs, new approaches to handling mental health. Thank you. All right, let's look at the next one. Here we have, I see the image is a little bit blurry, but I think you can still see that we're looking at Cancer and Interventional Radiology World Conference. So this one hasn't happened yet. This is coming up in September in San Francisco. You can see that it has an acronym. The acronym is CIRWC. So this is a CIRWC 2024. it makes you imagine that this is a conference that happens every year to the extent that the acronym is useful. So people don't want to say the whole name. So doctors might ask each other, are you going to see our CIRWC this year? Sometimes acronyms that are really long, people will actually say the acronym. So instead of saying, for example, what's one that we say? Well, this is one that we say the acronym and we say the letters, which is ASAP. So as soon as possible. Sometimes we say ASAP, but we also say ASAP. We pronounce it like it's a word. Get me this document ASAP, which is shorter. It's 2 syllables, ASAP instead of ASAP. So sometimes with long acronyms, we say them. Although this one, I don't know if we could say it like Surwuk, maybe. Yassine is telling me STAT. Yeah, STAT is an acronym that we say, except STAT, I don't think is technically an acronym, meaning each letter of STAT doesn't stand for something. I believe it's just a military term, but Google will tell us the truth. So that one did cross my mind, but I wasn't positive if we actually have a full word for S, a word for T, etc. Okay, so back to our conference here. Same as before, we have a website, we have a dedicated phone number, we have a logo, we have some kind of visual identity. I mean, it's a little bit less clear than the others, but we know that navy blue is important. If you notice this ribbon up in the logo, I'm not sure if you can see my cursor. So it's in the white circle. There's a ribbon in blue that's just above, like, I think this is a CT machine, either a CT or an MRI. Maybe because it's radiology, it's probably an MRI machine. But this ribbon that's above, in case you're not familiar, in the US, this is the cancer ribbon. This is the one that we use for different types of cancer. Yes, it does mean solidarity. And we have different colors for different types of cancer. So the pink one is breast cancer, and that's by far the most common. I believe there's a yellow one. I'm not 100% sure what it means, but these are ribbons that people will pin to their shirts. Let's see, PGC at the top, the thing that's hard to read, Precision Global Conferences. This is going to be the company that's been paid to run the conference, the event management company. And then last but not least, we have here the 7th World Conference on Diabetes and Endocrinology taking place in Valencia, and it looks like it took place just about last week. So same as the others, we have, this time they don't have a phone number, they have an email address on the right, they have a website on the left, they have the event management company in the corner, Innovine, scientific meetings. Not really logo happening here, not so much visual identity, but okay. So the point here is that these are different medical conferences. You could start to understand the conferences themselves, similar to conferences in Algeria, take on their own entire operation. So they have a website, they have a phone number, they have an email address. There's usually a private company that's paid to run them. So I share this with you because we'll speak later about how to attend these conferences. So it's important to know that they exist almost like companies. Like when the conference is happening, you can call them ahead of time as if the conference itself is its own privately operating company for the, let's say, 1 month prior, sometimes longer, depending how big the conference is, but I can almost guarantee that 1 month prior, you'll have a fully functional website, you'll have ways to get in touch with them, and you'll have a team running the conference as a job. So here's my definition of medical conferences. Now that we've looked at these examples, these are events for healthcare professionals to come together and share and discuss research, learn about new technologies. And yes, for those who said medication, I would put medication also next to technology, learn about new technologies and medications, and connect. So you could say, okay, connect is repetitive because we said come together and share and discuss research. But in fact, I put both of those there because there is, in fact, a networking incentive for medical professionals that exists outside of the research. So yes, some people might go and say, I want to discuss my research with someone. I'm looking for people working on similar projects. Great. But there's also just really great opportunities to look for jobs. through networking, through expanding your professional network, connecting with people at a happy hour event afterwards, and an after conference, an after work event, maybe even meeting someone at an event there, getting to know them. And then when you are looking for a job down the road, you have all of these contacts, individuals that you've connected with that you can reach out to. All with the goal of furthering research and development towards increasing health outcomes. Increasing health outcomes, actually, now that I read it, I prefer the term improving health outcomes. So essentially, all of the conferences that we just looked at, and we can see them again, are about improving or helping us combat diseases or improve outcomes for certain challenges. So we have one on diabetes, endocrinology, we have cancer, we have mental health, and we have psychiatry, so mental health. Oh, I didn't realize I have 2 mental health in there, actually. Interesting. Essentially noting that medical conferences, and I'm going to ruin my slide a little bit forward, but I'll just say that medical conferences there's an importance to them. There's a reason that individuals come together, and that is itself uniting, to meet people who are fighting something with you, who are working to help make the health of the world, of humanity, better in the same area that you are. Okay, tell me, what are the objectives? I've already given you some objectives, so either spit them back at me, the ones I've already given you, or add your own. I think I have 8 objectives that I have on the next page. What are the objectives of medical conferences? Why do we have them? What do we want out of them? Okay, to give doctors new recommendations in their practice. Good. Okay, I'm gonna let you keep writing. I'm gonna read them in a second. I have to turn this AC off because it's making me freezing. So just wait. I will be back in 30 seconds. Send me your ideas. I'm looking for 8, I believe 7, maybe 8 objectives of medical conferences. I will be right back. All right, no luck. I'm just gonna have to freeze. It's either the dog or it's the AC. It's something. If you see me doing this, it's because it keeps blowing on my face and it's tickling me. All right, what do we have? What do we have? To give doctors new, oops, let me go up here. I've lost my, to give doctors new recommendations in their practice, to share knowledge, to establish guidelines. Good. Oh, you sent me many things. To train physicians, to discuss new medications, to connect people, to train doctors about new technologies or new treatments, advertising, updating therapy tools, sharing experiences, and gathering resources to improve and implement new helpful ways in the medical field, and to help doctors from all around the world to connect and have teamwork. Let's see if you have all of them. Some of them, yes. I only saw one that I'm not sure is totally accurate, which is about training. Medical conferences are not usually where we do any kind of training. Continuing medical education, absolutely, great. Paving the way to young doctors to know what technologies are conducted abroad. I would say what technologies are used abroad. All right, upgrading and improving patient outcomes. Oops. Of course, I keep losing the ones that I'm reading. Upgrading and improving patient outcomes by providing the latest medication and recommendations. Providing a new view or results of a specific wrong or old research. Sometimes we do Insightful references. Oh, trainings. You're talking about training. Sometimes we do have trainings. Yes, trainings about, of course, using new technology, trainings if doctors are sharing their research. I wanted to clarify that the basic medical education training is not taking place at a conference. Maybe that seems obvious, but I wanted to be clear that doctors or medical students are not going to conferences for their foundational training. They're going for training on new technology, cutting edge research, a better or new approach to do something. Absolutely, these can happen in workshops outside of the conference. Sometimes these are extra workshops that happen sort of before or afterwards, or sometimes they're integrated within it. But these are very targeted trainings on skill development in specific areas or specific technologies. Overall, the goal of the conference is not usually a training objective as much as it is sharing research, sharing new ideas, and discussing innovation. Good. These meetings have workshops and they deliver certificates. Yeah, so continuing medical education is true. In fact, I have that later in my presentation as well. Some of them actually will count attendance at a conference itself as a certificate, like you get a credit, in the Algerian education system. I'm not sure if these are recognized, but I know that in European countries, many of them, and in Canada and the United States, there's something called credits. To graduate from a university, you need to have attended enough classes to get credits, but another way to get credits can be to attend conferences. And again, it does not have to do with trainings. You don't have to have a hands-on training to get a credit, but actually attending the conference itself can count towards your diploma. All right, so objectives of medical conferences. I have knowledge sharing, which I think everyone had beautifully. The sharing of knowledge between doctors, students, researchers, practitioners, great. And then we have connections and community building between medical professionals. I think later on I have networking or something like it. And I remember loving the word community building for this one because it's also talking about the social emotional aspect of conferences. So yes, when individuals choose to go to a conference, they're usually going for a professional reason. Like, I want to improve my skill set. I want to increase my access to new technologies. I want to learn more about latest approaches. Maybe there's a specific speaker you really want to hear speak. Those are the main motivations for attending. But when we look at surveys of the impact of attending conferences, and this is not just medical conferences, this is true for all conferences, often the most impactful element was actually feeling like you're in a community, because the nature of a conference is it's specific enough that everyone who's attending automatically has something in common. If you're going to that conference on diabetes and endocrinology, everybody you meet is already kind of a technical expert to a certain degree. So you find yourself in community with people around you, easily with something to connect on, an easy way to start to make friends, especially, this can be especially impactful for those of us who work in isolation. So if you're a family doctor, you have your own practice, you work alone, you're with patients all day, but you're really rarely with other doctors or other professionals in your field. Conferences can provide a key part of that support network. Then we have networking and professional development. So you can see that this is close, but for me, that social emotional aspect is important enough to put in a separate category. So networking and professional development, okay, yes, it can feel good. It can feel nice to meet people in the same field as you. But when we move into the word networking, we're really talking about career path. This networking is about getting jobs. It's about finding research funding. It's about finding potential collaboration or partners for joint projects. Conferences are an amazing place to meet the folks, to connect with, and move yourself further along your career path. Then we have introducing new technologies. So that is technologies and medication, because I always just said technologies in this slide. I can tell you now. So new technologies, this can be software tools. This can be tools to use as doctors or medical professionals, things like how to track patient history better. And then it can go all the way into very technical medical equipment that will help, stronger outcomes on a specific surgery. Presenting research, this is an obvious one that you mentioned in the chat already. Those who have finalized research projects will usually go on what we call a circuit, meaning they visit all the relevant conferences to present their research. And then recognizing leaders in the field. I didn't see this one in the chat, but it's an important aspect of conferences. So almost always conferences have some kind of award aspect. There's an award ceremony or there's a featured speaker, and the featured speaker was invited to come. So being invited to be the featured speaker is itself also a recognition. And it comes afterwards with a certificate and an honorable mention. But many conferences also, in addition to having a featured speaker, will have some kind of ceremony for the most innovative research of the year or a lifetime contribution award to research. And these individuals who receive these awards, this is something that they can use to build their CV, to get future opportunities, to get funding. So it's a key role that certificates play in the medical field, is providing recognition. So I think that is 1, 2, 3, 4, 5. Oh, there's only 6. There's not 8. Whoops. But I think most of them you had in the chat. Noelle is adding, conferences also aim to raise people's awareness of a specific topic. Thank you, Noelle. Yes, I accept that. That should be number 7. Actually, you've even motivated me to think of number 8. So maybe I did have 8 in my head, but they didn't make it on the slide. So number 7, raising awareness. Yes, especially conferences about poorly studied topics, studies that are kind of, or topics that are kind of neglected, that don't get a lot of attention, that don't have a lot of funding research, that don't have a lot of, research funded, flip those words. And then my 8th one that I'm thinking of is actually back to policy. So raising awareness, yes, among the general public, among the medical community, among the research community. There's also a very specific goal of conferences, which is to reach policymakers. So as before, when we say policymaker, we are definitely referencing politicians. So senators, governors, mayors, every level of government counts as a politician, not just the ones at the national level. But it's also quite rare to get the politician themselves in attendance. So policymakers is not just politicians, it can include their staff. So maybe their chief of staff, or maybe their, legislative assistant, the person who helps them write laws, the person who helps plan where they place priority, where they put their attention. It also will include, in the US, we have research groups that are called think tanks. Think tanks help write papers or produce research about laws, about policy that should be changed. So these conferences will try to attract members from think tanks, because they want the ones who will influence politicians to write papers that reflect research. So all of that big bubble is considered policymakers. So in addition to this list, we've added number 7, raising awareness about specific topics. Thank you, Noelle. And number 8, helping, we'll say, influence policymakers. Sydney is saying the ethical side. Well, I don't know what you mean by ethical side, but I can guess. I'm guessing that you're saying, is it ethical to invite policymakers to a conference? Conferences are for profit. They are not, they are making money. You have to pay money to attend conferences. The conferences cost a lot of money. They have to rent the space. They have to pay for, sometimes the people who get awards, it comes with financial compensation. So they're paying money to get someone very fancy to speak at their conference. They pay the company that's going to run the entire conference. So they charge money both to pay these fees, but also they're usually for profit. They want to make money from their conference. So some people might say, is it ethical to try to influence policy from something that is connected to profit? It's the same kind of conversation you'll hear around medication. Inviting policymakers to places where they're producing medicine. I can't answer that question for you. That's the world of where politicians and medical professionals can ethically and comfortably interact. Maybe is not always medical conferences. Maybe that looks more like inviting doctors to present research directly to politicians in a total nonprofit format. So there are definitely some ethical considerations to think about. Thank you. How is a medical conference different than other conferences? Is it like everything we're talking about? You could say every conference has knowledge sharing, every conference has networking, every conference is maybe raising awareness about something. Well, maybe not to the same degree. So tell me, in your mind, what are the things that make medical conferences unique, if anything? I'll give you maybe a minute to think about it and answer. And if I don't get any answers, I'll imagine everyone's at home scratching their head saying, I don't think there's anything unique. And I will present my ideas. You can tell me if you agree. I think I have three ways that they are unique. You have a lot of research being exposed in medical conferences. Okay, being shared. Let's use shared instead of exposed. Exposed in English really has a different connotation. It's very negative. The audience. Yeah, the audience is quite unique in medical conferences. Being presented. Thank you. Shown or presented is perfect. Hussein says, I think it's the same as a usual conference, except it's related to the medical field. Yeah, you could just say nothing different except the topic. Cool. Anyone else? 10 more seconds. Presence of pharmaceutical companies. Yeah. Ethics, Noel. Interesting. I'd be curious to hear more about that. If you can elaborate, what do you mean by ethics? All right, while I give Noel time to elaborate, I'm going to start sharing I think 3 items I have. So this is, I think Hussein said this. Well, when it's a medical conference, it's only in health-related topics, anything related to medicine and health. Easy. Then someone else said the audience. Who said the audience? Sydney said the audience. So, okay, I would say yes, we have a specialized audience, but you could argue that every conference to some degree has a specialized audience. What I would say is unique about a medical conference audience is that you have individuals with a relatively high level of technical knowledge, because most individuals have gone through 5 to 7 to 9 years of education. So whereas other conferences, let's say you have a conference on, I don't know, some kind of new software system, you have individuals, maybe even high school students, who have enough knowledge about coding that they could participate. They could come and gain some interesting knowledge. Whereas when we're looking at a medical conference, our audience level in general has a lot of years of education and training. And so we can assume quite a high level of technical knowledge. And then this is why I wanted you to expand on ethics, because this is how I wrote the part that you, I think, are touching on, which is that when we're talking about medical conferences, we're talking about issues that are very obviously important and serious. It's very clear. Everyone who is at a medical conference, maybe they're not all out to save the world. I mean, we have pharmaceutical companies that are trying to make tons of money. So I'm not saying everybody who shows up at the conference is a sort of angel or a do-gooder. However, unlike other conferences, there's a very clear sort of seriousness. We are all in the room to solve something serious, to solve something that hurts people at best, that hurts their quality of life, and at worst, that kills people. And so you have a sense of it's just so obvious why the conference is happening and why it's important. Whereas other conferences, let's say we have a conference about sunglasses. Sure, okay, it's fun, but there's no sort of unifying sense of meaning behind the conference. And that, I think, is quite unique to the medical field. Yeah, it concerns human beings. Thank you, Noah. Then I will add that medical conferences are quite unique in this aspect, which I think it was also Noel who brought it up earlier about these educational credits. It's quite rare to have conferences that can count towards your education. Medical conferences, because they are so heavily targeting students and researchers, and they're providing a lot of technical education. When you're going to a panel, you're increasing your knowledge, you're increasing your understanding, you're deepening what you've already learned in a traditional school setting that a lot of universities actually recognize simply attending a conference as something that can be counted towards awarding of a degree or of a certificate. So these are the 4 ways in which, truly it's 3 ways. The first one is a little silly. Every conference type will get this first bullet point. Okay, technology conferences are different because they're only focused on technology. That's sort of self-explanatory. Medical conferences are only focused on medicine. So we'll sort of leave that one aside. It needed to be said, but it's not so relevant. The last 3, I think, are quite unique to medical conferences. Next question. Who can attend? Who can attend these conferences? And also, who are these conferences targeting? Tell me in the chat. Doctors, medical students, great. Anybody else? Physicians, pharmaceutical companies, nurses, good. Doctors, medical field workers, drug companies. There's a few more I haven't seen mentioned yet. It depends on the topic, okay. Investors, interesting question, Yassine. Can investors attend? Most medical conferences are not connected to for-profit companies or for-profit startups, except for the ones who are already funded and presenting there. So I don't know. So I guess you could imagine maybe there's a young startup that has a new medical technology, but the reason they would be at the conference would be to reach the doctors. They want to reach essentially the customer being the doctors. They want the doctors perhaps to purchase the technology. So I suppose an investor could attend, but there are tons of investment conferences that are much better suited. Engineers, thank you, Sydney. Yeah, engineers working on medical technologies. Much to everyone who has a relationship with the medical field. Politicians rarely, as we said, it's not usually politicians, maybe staff members or distantly related to making policy changes. Here's my list. Healthcare professionals. Healthcare professionals is a general term that involves doctors, nurses, technicians, every kind of specialty, radiologists, dermatologists, psychiatrists, etc. Then we have students. So this is also nursing students and doctor students, medical students, nursing students, anyone who's studying. So both people who are already working in the field and people who are studying the field. Then we have researchers. So researchers are people who usually are doctors themselves who decided to pursue a research track, but not exclusively doctors. We have the option, especially in the United States, where you can study what's called pre-medicine. And then once you're ready to enter medical school, you can actually choose, do you want to be a doctor or do you want to be a researcher? So they are never themselves qualified as doctors, and they are permanently, from the beginning of their career, medical researchers. They never perform in a private practice or in a hospital, only in laboratories and places where they can do trials. Policymakers, as we discussed. Developers of medical technology. So that's why I said to Sydney, thank you. And you said engineers, right? Because while we don't necessarily have investors who are coming to these conferences, we will have people who are already working in the field of developing medical technology. They are likely coming, number one, to show their equipments. So perhaps they have a booth and they're trying to sell, they're trying to share, but also to check out the competition. This is one of the best places for the companies to see what their competitors have also developed. Oh, that's it. Oh, I thought I had one more. Healthcare professionals, students, researchers, policymakers, medical technology. Okay, I think that has mostly everybody. This is what I had. I knew I had one more element to this slide. Here it is. Some conferences are open to the public. When we say open to the public, we mean literally anybody. You can go, your friend can go, your grandfather can go, just out of curiosity. You don't need any kind of specialty. You can just wander on in. Others are limited. They say, nope, actually, we only want specialists in this one specific field to be here. To keep in mind here is that conferences are not free. So when we say they're open to the public, it could be that that is a strategy of making sure that they can get the most money possible from having the most attendees. And the ones who are restricted or limited maybe have less of a profit goal and more are focused on having an intimate connection. Maybe really they're focused on networking, or maybe it's a members only community that are meeting and that is their priority. All right, now Wella is saying sponsors. So sure, sponsors can come to medical conferences. I would not say that they are the target. They come because they want to advertise, and usually sponsors in a medical conference will themselves be the pharmaceutical company or be a producer of technology. So it's someone who's already interested in the topic and who already would be an attendee at the event. So sure, sponsors can come. I suppose you could have a sponsor who's totally different, like Coca-Cola, and they might come just to have a booth at the front, but I don't think that they would attend the sessions. No one from Coca-Cola is going to sit through a research panel. Then nonprofit, Mohammed suggests nonprofit organizations and associations. Sure, especially for the raising awareness part. If you have nonprofit associations who work in a field very similar, so you can imagine for any healthcare issue that we would call a public health issue, public health meaning it affects the average everyday person. You find them very commonly, like diabetes is a public health issue. You'll find a lot of nonprofit organizations trying to help spread awareness, combat the disease, help people living with it. So yeah, they might attend as well. How much do medical conferences cost to attend? Before you send a specific amount, I can tell you right now, there is no specific amount, but I just want to see if you have an idea or if you've attended one, how much it cost, because the answer, I'm going to spoil it. The answer right now is they can cost everything. Any range of amounts, you'll find a conference that costs that much. And I'm gonna have to move because this AC is freezing me, so excuse the noise. Okay, that is just so much better. Now I can survive and breathe. Okay, sometimes it's for free. Sometimes it's free, like in the CIC, this is the conference center in Algiers, from 1,000 dinar to 8,000 dinar, a bit more. Okay, I put my numbers here in dollars. So you'll have to excuse me and you can convert them into dinar directly. So I'm just going to show you the slide because I think the answer is a little less interesting for those to contribute. So conferences are rarely free. In fact, the only times they are free is when they're sponsored by the government. So when you're in a country like Algeria, where the government sponsors a lot of research, you're going to find free conferences. When you're in a country like the United States, where research is almost all funded by universities and private companies, you're not going to find very many free conferences. However, if you are a member of an association, and usually that membership is paid, so you pay annual fees. Sometimes what they do is they allow you to then come to these conferences either at a very good discount or for free, or if you're an invited speaker. So if you become a very famous doctor, famous researcher, and all around the world you're getting invited to conferences, not only are you not paying for those conferences, you're also most likely receiving money to come to the conferences. So early on in your career, you might be paying to go to a medical conference, but who knows, later on in your career, maybe you will be paid to go to a conference. Prices range dramatically. There's a huge difference in price because there's also a huge difference in conferences. I mean, you can have a medical conference that lasts one day, and then you can have one that lasts 6 days. I picked this range just because I wanted to put a number on the screen to put into people's minds, but really the range is much, much greater than this. So I said it could be around $500 to $1,500. What this tells you and what this should tell you is that medical conferences nowadays are really expensive. These are not a $20 ticket to attend. It is really expensive. What it means is that you will meet only certain kinds of people. You will meet doctors who come from hospitals that have money, because usually the hospital will pay for the attending of conferences, or from universities that also have money or are well funded. So individuals at conferences tend to come from professional organizations that can sponsor them attending. Sometimes there's even extra fees. Extra fees for things, especially earlier on when someone was mentioning in the chat about training workshops where you get certifications. Usually these come as an add-on or an additional option outside of the conference that you can pay extra money in order to participate in. And then last but not least, the good news is there's often discounts. So there are things called early bird discounts. This is if you register really early, you pay a much cheaper price. And a lot of conferences have super low fees and sometimes even free attendance for students. So it's not all bad news. You do have to factor in when you're thinking about a medical conference, however, is the travel. So even in Algeria, imagine you're not from Algiers to attend the conference, you have to look for lodging, you have to look for transportation. And then if you want to go to a conference abroad, that can really start to raise the bill. The good news is that there's a lot of virtual conferences or conferences that have some presentations done virtually. The bad news about that is they're still charging money. So the virtual conferences are also themselves not free. How do you apply to attend the medical conference? I'm just going to tell you because, again, this is not really worth group participation in. So all of these conferences, this is one of the reasons I was showing you the pictures of them before when I said, what is a medical conference? We looked at 4 examples, was to show you that they all have their own websites. So conferences are very professional organizations at this point, or excuse me, I should say conferences are very professionally organized. They're not technically organizations, but they are organized in a very professional manner. And so you can find all the information that you need on the website. It's not invite only. It's not word of mouth. It should be something, especially if it's happening in Europe, the US, or Canada, that you can truly find all the information that you need on the website itself. In fact, the website only exists truly so that you can sign up. So the entire design of the website should make it very obvious and very easy to sign up. However, you usually do need to pay money at the time of registration to reserve your spot. They will not take a reservation without some sort of financial guarantee in most cases. And it should be mentioned that some conferences have scholarships, so you can apply and say, hey, you know, here's why I want to come, but here's why I can't afford to come. And if you have an interesting profile, sometimes conferences will actually waive the fee, meaning they'll let you come for free. Sometimes, and this is very rare, they will even pay your fees. So they'll pay for your flight and they'll pay for your hotel in order for you to come. So do not despair. Get comfortable with the website of the different conferences you're interested in and see what they offer. And you might find some interesting opportunities to attend conferences. All right, that is my whole section on what are medical conferences to make sure we're on the same page. Now I have 1, 2, 3, 4 vocabulary games, and then we will call it. When we say call it in English, it means then we will finish. So let's do some conference vocabulary. You'll notice I have little asterisks next to conference. That's because there's no vocabulary that is specific to medical conferences. So this vocabulary is conference vocabulary, and it's specific jargon or technical language that you will see and hear if you attend a conference in English. So we begin with abstract. Oops, I believe I'm supposed to ask you, I'm trying to remember, I think I ask you and then I show it, but abstract is already there. So an abstract, when people talk about an abstract, we're talking about a summary of research. And you will find it right at the top of the paper. So before you read the 10 pages or 20 pages or 100 pages of research, you have a brief summary at the front, at the very top, and this is called an abstract. It's a technical word. We use it anytime we're referring to research, and we do not use the word summary. We only use the word abstract. Keynote speaker. Who knows what a keynote speaker is? I'm only going to give 30 seconds because if I give more, I'm sure people will just research that online. Keywords, not quite an important person in the presentation. Okay, it is an important person, not necessarily in a presentation. Keynote speaker is a distinguished speaker who delivers the main address at a conference. A main address is the speech. So keynote speaker is that one big person whose picture they put on the flyers on the website. Keynote speaker at really fancy events will be famous people. So, you know, maybe Barack Obama will be the keynote speaker of not a medical conference, but a conference on something related to politics or something he's interested in. So the keynote speaker is that one big speaker who is invited to give a speech at the event. I see from Hisham and Nawal, these are not correct. It's not someone who takes notes, and it's not someone who's participating in research. All they're doing is coming to give a speech. That's it. And it's usually someone very famous. Breakout session. I'm going to move through these because even though I thought this presentation would be short, we're actually kind of cutting it close on time. So breakout session. This is a session that is broken out of a main workshop or discussion. So a breakout session is when you split the attendees into small groups and you discuss specific topics. So if I have, let's say, a panel discussion, we have 3 experts. We're going to ask questions, and then after 20 minutes, we take all the people in the audience, we split them into different rooms, and we have the panels, you know, the experts go to each room and talk to them, or we give each group a task. It's just a way of saying that we split the workshop into small sections. Round table is quite self-explanatory. It literally means everyone is sitting around a table, but the emphasis is on collaboration and what's called open dialogue, meaning people can be very honest. Everyone at the table is supposed to share their opinion, is supposed to speak. And the idea is that we are joining together to bring the best ideas forward. So it's not one person speaking and everyone listening. A roundtable discussion is everybody should come prepared to contribute. All right, abstract, keynote speaker, breakout session, and roundtable. Oh, okay, before I do match the definition, let me explain it. We have the next game, which I think most of you have played before because I've now been doing it for a few weeks. I think it's really fun. I have 4 vocabulary words listed with numbers, 1, 2, 3, 4. And I have 4 definitions listed with letters, A, B, C, D. You need to match. So they're not in the correct order. You need to match the vocab word with the definition. When you have them, just send them in the chat. So you can say 1C, 1D, 2B, etc. So here we go. We have 2 rounds of this. Here's the first one. All right, I see answers coming in. I'm going to give another few minutes for folks who want to finish. This one has a lot of text. Okay, great. I see the answers coming in. They look correct to me, but let's go through this. Number 1, slide deck. That's the easiest one, I think. What is it? What letter? Number 1? I see you putting it in the group yeah. D. I see you put it in before, so I'm just asking you to put it back in again, just to tell me that it's D. So a slide deck is a collection of slides used in a presentation. The reason that I put this here is because this is very commonly used. Instead of saying, I've prepared a presentation, researchers will often say, I've prepared a slide deck. So you can say it's almost a synonym for presentation. People say, oh, I have a whole slide deck about this. Or, oh, it took me forever to put my slide deck together. It really is an exact synonym for presentation. And it's basically just describing that it's a group of slides. All right, so that one, hopefully you will find useful. Number two, what letter is number two? A. Awesome. Findings. Findings are the results or conclusions derived from research. Great. And what we are often presenting at medical conferences are findings of research. Beautiful. You'll hear this stated in research studies in the abstract. The findings are conclusive, or the findings are inconclusive. Findings meaning the overall results of the study. Great. 3, clinical trial. What are we going for? What letter? Clinical trial. 3C. Awesome. Clinical trial is a research study that tests how well new medical approaches work in people. So essentially, before a new drug goes to market, it goes through a clinical trial where they have individuals actually take the drug. But you will also have a clinical trial for new approaches, new technology, new devices. Anything that is different and new needs to be approved by the relevant authority. So every country has some kind of national body that dictates which procedures are allowed, which medications are allowed. And these new procedures have to go through a clinical trial period. Also, research findings need to be validated. They need to say, if you want to say that this has certain results, the clinical trial is the way that you will prove that these results actually are correct. Oops. Oh, giving one next one. All right, so that means peer review is what? Yeah, there's only one left, right? So I guess we're stuck with B. Peer review is the process of evaluating the quality and validity of a research study by experts in the field. It's funny to see the long explanation because the word itself is self-explanatory. Peer review is when other experts, so the same level as you, if you're a scientist and you've produced research, you send your research to another group of scientists, to your peers, and they review your results to make sure that they are accurate, that you are not misunderstanding your data, you're not lying about your data, that you've taken the necessary steps to validate what you've discovered. And then once it has the approval of a peer review, it can be published. This is why we often talk about articles, scientific articles, as peer-reviewed articles. Or on journals where they publish research, we call them peer-reviewed journals. Great. Round 2 coming up. On your mark, get set, go. Same rules, new words. All right, answers are coming in. Do one more minute. See if you got them all. Let us begin. Number 1, conference chair. What letter am I going for? D. Thank you. The conference chair is the person responsible for organizing and overseeing the conference. It's not a chair at your kitchen table. It's a person. Funny thing about this word, you can have a conference chair and it's referencing the person. It's also the verb. So a person chairs a conference. The conference chair chairs the conference. Great. Number 2. 2B or 2C? Let me see. I'm getting 2 different answers. Abstract submission. Abstract submission is going to be B. So B, abstract submission. It is the submission of abstracts, which we learned from not last slide, but the one before. An abstract is a summary. So abstract submission is the process of submitting a summary of a research study for consideration. So when we want to enter a conference, we want to do either we want to be part of a panel, or we want to have a booth, where we explain our research, but in some way or other, we want to present our research at a conference. Usually there's a lot of people that want to present their research. And so the organizers of the conference will only select a few people to present. How do they choose these people? Well, they review the abstracts. They're not going to read hundreds of pages of research, so they just read the summary. So at the beginning of the conference presentation process, they review abstract submissions, and then they will reach out to you and say, the abstract was really interesting. The research sounds great. You're invited to present at our conference. Cool. Number 3, call for papers. Call for papers. 3A. Thank you. That is correct. So call for papers is an invitation for researchers to submit their work for presentation. So this is actually directly connected with abstract submission. In fact, a call for papers happens first. The conference organizer will put out, that's the verb we use here, put out a call for papers. Then that call for papers will be in the form of a Facebook post, an email, a post on their website. Maybe they'll share it with associations or universities directly. So this call for papers, it's usually an explanation of what they're looking for. Maybe it's a breast cancer conference. They're looking for researchers working on topics related to breast cancer. They want you to submit abstracts. So you send, the organizers put out a call for papers, and those researchers who want to participate, this can be either for an event or for a journal who's looking for articles, send their abstracts. They do an abstract submission in order to see if they'll be selected. Awesome. So that leaves us with 4, literature review, which means we have to be left with C. Literature review is a comprehensive survey of publications relevant to a research topic. Literature review simply means that you have read all the literature, all the articles, and all the research about a topic. Usually before you contribute new research, you have to understand and analyze existing research. In fact, the requirement is often that within your own paper, you provide a literature review, so a summary of all the existing research or the clinical trials, everything that has been done related to what you're about to talk about, you must include that within your own study. Great. I saw a few questions coming in. Yassine, how do they know if a presenter is skilled? Sometimes they're very boring. Well, the answer is they don't know if they're skilled. Presenters are chosen based on research, not based on personality. There's no interview involved, which means a lot of conferences have boring presenters. It's true. Next question from Yassine also. When do the organizers do a call for papers, and when do they ask for abstract submissions? So a call for papers is them asking for abstract submissions. It's just, I'm giving you 2 different vocab words to describe flip side of the same thing. So when you call for a paper, you never are hoping to get the whole paper back. You just want an abstract back. I would say maybe 2 months before the conference, you'll get a call for papers with a deadline, let's say a month before the conference. The reason is that the conference organizers need to publish the panels, the topic of the panels, the names of the researchers, and they use that information to attract attendees. So the call for papers happens maybe even earlier than 2 months. It happens really far in advance of the actual conference. And then when you know that you've been accepted, you have a little while to prepare yourself, to prepare to present. Great. All right. We've done 3 out of 4. My last one. This is where I check your knowledge of the last, we've just learned 12 vocabulary words. Now I'd like to know if you can think, what am I describing? What is this example of? I'll read it out loud. You can read to yourself. Mohammed is the pivotal organizer of the event, overseeing all aspects of planning and execution to ensure everything runs smoothly. He coordinates with speakers, manages the schedule, and handles any issues that arise, making sure the event is a success for all attendees. What am I describing? Yeah, we have a few who already got it. For those who aren't checking the chat, you can see a conference chair. the main central organizer of the conference, as well as the sort of spokesman for the organizing team. Next. What is this an example of? Hania oversees the investigation where new treatments are tested on volunteer participants to evaluate their safety and efficacy. She coordinates with the medical team, ensuring all protocols are followed and data is meticulously recorded. What am I describing? Not Hania, not her role. What am I describing? We have peer review, maybe. We're looking at a process where new treatments are tested on volunteer participants. New treatments are being tested to see if they work. So Mohammed gave it to me. He put it in hosts and panelists only. So others, yeah, clinical trial. Beautiful. So it's not a peer review because peer review is when we are reading research. Peer review, we read the research that other people have done. In this one, we're talking about organizing a process where new treatments are actually being tested. So that is a clinical trial. Next, what is this an example of? Nawal is currently preparing a concise summary of her research findings for submission to the upcoming medical conference. She meticulously compiles the key elements of her study, ensuring clarity and adherence to formatting guidelines. She aims to present her research effectively to peers and experts in her field at the conference. What is this an example of? We have abstract paper, we have peer review. Anyone else want to chime in? Because we have two different options here. Findings, okay, we have a lot of different options, 3 different options. I want you to focus on the first sentence. Nawal is currently preparing a concise summary of her research findings. She is preparing a concise summary of her research findings. I give a big hint there. Abstract submission. I will also accept abstract. So for those who said findings, okay, it's the findings are included in the paper. For peer review, it doesn't work because peer review is when you review someone else's research, and we're talking about Nawal's own research. She's creating a summary of her own research. So that's abstract or abstract submission. Slide deck is just about PowerPoint presentations where you have slides. So since she's not preparing a presentation, rather she's preparing a summary, we are in the land of the abstract submission. Great. Next, what is this an example of? Yusuf is organizing a specialized session within the conference program, focusing on in-depth discussions and interactive workshops on specific topics. He ensures that the sessions are tailored to meet the needs of participants seeking detailed insights and practical knowledge in their respective fields. What is this an example of? Okay, we have workshop, we have roundtable. I'm going to wait till I get a few more. We have here a specialized session. It has interactive workshops on different topics. Lots of little interactive workshops on different topics. Some could, oh, no, well, I see you have it. This is correct. Breakout sessions. So, well, breakout session. A breakout session is when you have a lot of small groups having different discussions about a specific topic, and they're designed to be extremely interactive. They're really focused on interaction because in small groups, everyone gets a chance to speak. All right, we have one last one. What is this an example of? Rami is orchestrating, which is a fancy way of saying organizing. Rami is orchestrating an intimate gathering within the conference agenda designed for collaborative discussions among experts in their field. This session brings participants around a table to engage in open dialogue, sharing diverse perspectives and insights on preparing industry topics. Maybe this one's a little easy because we even say around a table. Very good. You got it. This is a round table. Okay, what you should focus on here is the intimate gathering, right? Only so many people fit around a table, so it can't be a big group. Open dialogue and looking for collaborative discussions. All of those are roundtable. That's everything I have. And in fact, we're finishing right at 8 o'clock. So I don't know why I thought this would be shorter. There was clearly enough to say about medical conferences. It was really a pleasure to work with all of you. I will miss seeing you every Sunday evening. I've come to recognize the names in the group, and I'd love to one day also recognize the faces. I'm trying to go to my thank you slide. There's my thank you slide. Thank you so much. I hope this was interesting for you. If you ever do think of other ideas that you'd love webinars on, I'll put my email right here in the chat. You're welcome to reach out and let me know. Otherwise, these will be on YouTube shortly, not immediately, but shortly. And I wish you all the best in your careers, in your studies, in your futures, however they may shape up. Thank you for your time. Thank you for your attention. It was truly an honor. Have a good evening, everybody.